Bismillahirrahmanirrahim. Assalamu alaikum. So today in this video we are going to learn about proton pump inhibitors that are the most widely used drugs in Pakistan for gastro problems like dyspepsia, peptic ulcer, gastroesophageal reflux diseases, and gastritis, esophagitis, and also in the Zollinger Ellison syndrome. So these drugs were developed in 1980, but they were launched in the market in 1988 in the form of omeprazole. So these drugs can be identified by the suffix prazole, P-R-A-Z-O-L-E, prazole. For example, we have in the market, in Pakistani market, Rizek, that is omeprazole, Nexium, that is esomeprazole, and also the Protonix, that is pantoprazole. We have two others like dexlansoprazole and also the you can say rabiprazole. So continuing to their mechanism of action, let me first tell you about some basic structure of the stomach. So in our stomach there are in our stomach wall actually there are parietal cells in which we have the gastric proton pumps, also called as hydrogen potassium ATPase enzymes. So what these enzymes do? So when we take food in our stomach, these pumps are activated and they efflux hydrogen ions into the stomach lumen. So when hydrogen ions are present in the stomach lumen, there is ultimately the increased production of hydrochloric acid, which can lead to multiple problems. Although this hydrochloric acid is helpful, very helpful in digesting our food, but increased production can lead to multiple problems that I already told you, like dyspepsia and other many gastroesophageal reflux diseases. So what these drugs do? So when we take these drugs, they bind to those proton pumps, and ultimately they don't allow, simply saying, they don't allow the proton pumps, sorry, the protons or hydrogen ions to come into the stomach lumen. So when there is a less production of hydrogen ions, there is a less production of hydrochloric acid. So ultimately they can relieve the pain related to the peptic ulcer and also the other many gastric problems. So these drugs bind with a covalent bond to these proton pumps. So in this way, they can control the symptoms for a longer time also. So continuing to their you can say pharmacokinetics, these drugs can be taken by oral routes or by also the intravenous route, like that is taken mostly for the peptic ulcer. But there is one more important point, and it's very important that these drugs must be taken empty stomach. Otherwise, their activity or therapeutic index will be decreased exponentially. So you always tell your patients as a information that these drugs must be taken 30 minutes, at least 30 minutes before their next meal. So I told you that these drugs bind covalently to the proton pumps. If they bind covalently to the proton pumps, how they are metabolized? So in our body there is a endogenous, you can say, uh, antioxidant, that is glutathione, and this antioxidant is responsible for the dissociation of the uh, proton pump inhibitor and proton pump complex. So this antioxidant causes the dissociation, and ultimately the drug is metabolized in the liver by the CYP450 enzyme system. So we talked about the introduction of the proton pump inhibitors, their medical use, their pharmacokinetics, their mechanism of action, and now let's talk about their we can say adverse effects. So there are some adverse effects related to the proton pump inhibitors, and these are like headaches, nausea, diarrhea, and dizziness, rashes sometimes, and also the itching. And one more thing, they can also cause the osteoporosis. And now you will wonder that how it can cause osteoporosis. So when there is a decreased production of hydrochloric acid, there is a less production of calcium also. So as when there will be the less production of the calcium, there will be ultimately the less supply of calcium to the bones, and that can lead to the you can say bone weakness. So these drugs should not be taken for the long time. Unfortunately, in Pakistan, these drugs are available, or you can say dispensed over the counter. I always encourage that these drugs must be taken with a valid prescription of a physician or a medical provider. So these drugs should not be taken for the long time because it can lead to the multiple problems. So I hope you liked my video about the proton pump inhibitors, and we will meet you in the next video. So pharmacist Zawar Ali signing off. Thank you.